Good evening, Mr. Doe. How are we feeling? That's great. I'm doing great. Thank you for asking. My name is Megan Davies, and I'm going to be your student nurse for the day. Can I go ahead and confirm your name and date of birth? John Doe, April 11th, 1999. Perfect. And do we have any allergies to any medications that we know of? No? What about shellfish or iodine? No? Okay, sounds good. So it says here we got an order for a Foley catheter today because you have some urinary retention, so it should give you some comfort. Does that sound okay? Awesome. I'm gonna go ahead and start off by raising the bed to a comfortable working height. Right about there. And I'm gonna put on this fresh pair of gloves. Okay, so for cleaning your perineal area, I'm gonna go ahead and remove the bed sheet to about here. You might get chilly, so I'm gonna work as fast as possible, okay? All right, I'm going to reveal your perineal area. Great. All right, I see that you already have a wet pad down here and it looks completely clean, so I'm gonna go ahead and use that one instead of using a new one, okay? Great. I have a warm rag here with water and soap. And I'm going to start cleaning from the tip to the base. I'm going to touch you now. Great, dispose of this. I'm going to get a new towel to dry the area. I'm going to touch you again from tip to base. Great, so I saw no signs of infection and no leaking or anything like that. I'm going to remove these gloves and perform some hand hygiene. How are we feeling? Good? Great. So I brought an extra pair of sterile gloves just in case anything happens. Shouldn't need to. All right, so here we have a 14 fringe 10 milliliter bowl, which may mean nothing to you, but to me, it means that it's the correct size for you. All right. Now I'm gonna ask you to spread your legs a little bit more for me. Great. This right here is gonna be my sterile field. I'm going to place the kit down here with the tab facing me, so when I open it, I don't reach over and contaminate the sterile field. So I'm going to open the tab away from me and taking care to only touch an inch of the border to not contaminate the field. Great, I'm going to grab the sterile gloves out of here. I'm going to move over to the table for a stable area with the sterile field that I've already laid out still in sight. So I am going to open these. I'm going to perform hand hygiene one more time. And again, taking care to only touch an inch within the border to not contaminate my sterile field. I'm going to pop this bag open. All right, so with my non-dominant hand, my left hand, I'm going to touch only the inside of the glove. And I'm going to insert my dominant hand, taking care to only touch the inside of the glove, remaining in the sterile field. Great. And with my sterile glove, I'm going to reach under with my 4 fingers and tuck it underneath the cuff like so. Going to insert my hand and snap it on. I'm now going to move immediately to my sterile field over here and take out the wet pad. I want the blue side down, so when I open it, I'm going to cuff it around my hands and make sure it's not touching my skin that's not gloved. I'm going to tuck it under the patient like so. And I'm going to remove the drape. And I'm going to drape it over the patient's penis. Shiny side down. Great. All right, next I'm going to remove the top casing and insert the syringe of saline. I'm going to only uncover the part that I'm about to reveal and inserting the saline syringe. I'm going to place it back in the sterile box. Great. Next, I am going to open the iodine swab sticks, but for the purpose of this video, I'm not going to open them just so that they're reusable. So I would open them and place them in the container and discard of this, making sure my hands are above my waist. Next, I'm going to open up the lube, and for the purpose of this video, I am going to open it. I'm going to squeeze out a good amount of lubricant. And again, staying above my waist, I'm going to dispose of it. All right, next I'm going to unwrap the catheter, taking care that none of it touches the outside of the box. And I'm going to fold it back into the sterile box, throwing this away above my waist. Next, I'm going to clean the penis, and I'm going to grab a swab, and I'm going to place my penis towards the base. I'm now not going to remove my hand because this has been contaminated. So I'm going to move the swab from tip to base, discarding above my waist, grabbing the next swab, moving around, discarding above my waist, and getting the last swab, circular motions, tip to base, and discarding above my waist. Keeping this hand here, I'm going to grab my sterile hand, and I'm going to kind of roll up the catheter so that it's easier for me to insert and none of the tubing touches anything that's not sterile. So I'm going to lubricate about 1 inch to 2 inches of the tip of the catheter. And I am going to now insert the catheter. I'm going to take great care not to touch the tip of the penis because that would contaminate my glove. Feeling a little bit of resistance, so I'm going to go ahead and kind of twist it a little bit all the way up to the Y. Once I've reached the Y, I'm going to go ahead and take my contaminated hand and hold it while injecting the saline into the balloon, the full 10 milliliters. Great, still holding the syringe down, I'm going to remove it. Place this back in the box. And now it's going to release out until the balloon is in the right place. I'm now done with my sterile field. So I'm going to start by hanging the bag onto the bed, not the bed rail, and making sure that there's no kinks and no curves. Great. And next I'm going to tape the tubing to his leg for comfort. gonna leave a little bit of extra space just for the comfort of movement. All right, perfect. And next, I'm gonna start cleaning up my sterile field, which is no longer sterile. How are we feeling, Mr. Doe? See, I said I was gonna be out of here quick. Okay, I'm gonna dispose of this. So I noticed that we have some iodine left over. I'm gonna go ahead and clean that off for you, okay? Okay. Great. And I'm gonna go ahead and get a dry towel as well and dry the area. Okay, let me dispose of this. All right. And how are we feeling? Great. I'm gonna go ahead and pull the sheets back up. And lower your bed to the position it was before. Okay. And I'm gonna place your call bell right here. Just in case you need anything, you let me know if you need to get up for any reason. And I see that your personal belongings are close by. And is there anything else you would need from me? No? Perfect. Alrighty, I hope you have a great rest of your night, okay? Thank you. Good evening, Mr. Doe. How are you? Great. My name is Megan Davies. I'm gonna be your student nurse for the day. Can I go ahead and confirm your name and date of birth? John Doe, April 11th, 1999. All right, checks out. And I remember last time you said you don't have any allergies. Is that still correct? Still no shellfish or iodine? Got it, perfect. All right, so I have an order here to take out your catheter. I know, very exciting, very exciting. So I'm gonna put on a fresh pair of gloves to remove the contents of the catheter bag. All right, so for the purpose of this video, there isn't anything in the bag, so I can't empty it out. But I would empty it out into a graduated cylinder or a measuring cup by pulling this down and releasing this until the bag is empty, plugging it back up. And I would document all of my findings, whether it's the measurements, the color, the odor, all of those good things. Next, I would remove my gloves and perform hand hygiene. All right, I'm gonna raise the bed up to a working height. Great. I'm gonna pull back the sheet a little bit. And raise up your gown to reveal your perineal area, sorry. So next I'm going to put on a new set of gloves. And with an empty syringe that goes up to 10 milliliters, I'm gonna go ahead and plug it in to release the saline from the balloon. I want to make sure that 10 milliliters comes back out because I put 10 milliliters in. All right, and I'm going to remove this. Next, I am going to untape this from his leg. and pulling straight out, I'm going to remove the catheter. There is a waterproof pad underneath to catch any drops. Okay, and I'm going to discard this in the biohazard trash can. And I'm just going to clean up any areas that are necessary. Okay. Now I'm going to throw away this, remove my gloves. I'm gonna cover you back up now. How was that? Was that okay? Great. Here we go. And are we feeling any pain? No pain. And how's your position? Let me lower the bed for you. Gotcha. Okay, and your personal belongings are right here. I'm gonna put your call bell right here as well. And I see no more tubings, which is good for you. And also, next time you have to use the restroom, you gotta let me know, okay? Yeah, we need to make sure that we monitor the next void that you have after we move your catheter. So the call bell's right here, so hit it whenever you need me, okay? Perfect. Is there anything else I can get for you? No? All right. You have a great night. Of course. Thank you so much.